Buckeye Health is raising awareness during American Heart Month. They are encouraging all community members to live heart healthy by understanding the risk factors and symptoms of heart disease. So joining us this morning is Dr. Peter Kambelos. So thank you so much, first of all, for talking with us, because this is a really important topic that a lot of people need to be aware of.
Happy to be with you. Thank you.
Yeah. So first of all, COVID-19, with over the last couple of years, there has been different reports, different studies done as far as how it impacts our heart health. So what can you tell people maybe that they need to be aware of, or maybe the signs, symptoms they need to look for if they were diagnosed with COVID-19 in the past?
Of course. So COVID-19 is a multi-system inflammatory disorder and can affect the heart and other organs. In some ways, a virus like the COVID-19 virus can directly damage heart, muscle, and certainly as a result of, let's say, for instance, lung inflammation, lung infection, it can put added strain on the heart. So those are possible ways that COVID-19 can directly affect the heart and the vascular tree. And some of the signs and symptoms could be exertional shortness of breath, discomfort in the chest, swelling of the extremities, the feet, the ankles. Sometimes other symptoms could be included, such as difficulty laying down flat, in terms of getting your breath, discomfort, once again, in the chest, nausea, upset stomach. The symptoms can be very incredibly varied from individual to individual.
And obviously people got different varieties of the COVID as far as those symptoms go. Some people had more severe symptoms, they were hospitalized, and then other people it just felt like a bad cold. So I mean, is it really you need to look out for those symptoms either way, or is it really if you had more of the severe case of it?
Well, all of those symptoms are important about which to be aware. You know, some of the more severe symptoms of COVID-19 infection could be respiratory in nature, but in many cases they are. They may not be. However, all those symptoms are important for which to monitor.
Okay, and then just as far as heart health in general, getting kind of away from COVID-19 and just general, how can we really make sure we're keeping up with our heart health? What do we need to be incorporating into our diet and be doing exercise-wise every day?
Well, you know, one of the most important things is, and we call it primary prevention in the field of medicine, and that's knowing your risk factors. So we'll start by saying that folks should visit their physicians and get a checkup, have their cholesterol levels measured, have their blood pressure measured, their blood sugar. And in terms of personal things an individual can do to help lower the risk of heart disease, that could include weight loss. It could include regular exercise, quitting smoking for those who smoke, and once again, getting their, let's say, blood risk factors evaluated, blood pressure and so forth.
And as far as the stress levels, we all have felt very stressed over the last couple of years. Life in general can be very stressful. And how much impact does that have really as far as heart health and maybe doing damage in the long run?
Yeah, you know, possibly it does. You know, we're all under a great deal of stress, especially during this pandemic, many of us. So, you know, that stress, that, let's say, elevated blood pressure as a result of that, direct inflammation can certainly increase the risk of heart attack and stroke.
All right. Well, we appreciate you taking the time. If people have more info or need more information just about this topic, where can they go?
To our website, buckeyehealthplan.com. We are available to help our members. We have many case management options that we can use to help members connect with heart healthy options.
All right. Thank you so much. We appreciate it. Have a great rest of your week.